Everyone told me the second trimester would be easy. You'll feel great. You'll glow. It's the honeymoon phase. Here's what they didn't tell me. Yes, it's easier than the first trimester, but it comes with its own challenges that nobody warned me about. Today, I'm breaking down the second trimester week by week. What's actually happening in your body, what tests you'll have, and what symptoms to expect that nobody talks about. Because you deserve to know the whole truth, not just the Instagram version. Hey everyone, I'm Diana, and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health, and I'm a mom of 3. And here's what I want you to know about the second trimester. Your energy returns, the nausea fades. You're not huge yet. You can still see your feet, but it's not all glowing skin and easy, breezy days. There are challenges, there are discomforts, and there are some scary moments mixed in with the exciting ones. So today, I'm walking you through weeks 13 to 27, what to expect physically, emotionally, and medically. Let's start at the beginning of the second trimester. Welcome to the second trimester. Week 13 marks the official start. This is when things typically start to shift from surviving to thriving for many women. What's happening with your body? Energy is returning. For most women, the crushing fatigue of the first trimester starts to lift around week 12 to 14. You can stay awake past 7 p.m. again. You can function at work. You feel more like yourself. With my first pregnancy, I remember waking up one day around week 14 and thinking, oh, I feel human again. Nausea is fading. If you had morning sickness, it's likely improving or gone completely by now. You can eat normal foods again without gagging. If your nausea isn't better by week 16, talk to your doctor. A small percentage of women have nausea throughout pregnancy, but it's worth checking in. Your belly is showing. By week 16, most women have a visible bump. It's not huge yet, but it's definitely there. First, time moms tend to show later than women who've been pregnant before. Your abdominal muscles are tighter with your first baby. Libido might return. Increased blood flow to the pelvic area can actually increase arousal for some women in the second trimester. If you're feeling it, sex is generally safe during pregnancy unless your doctor has told you otherwise. What tests happen in weeks 13-16 second trimester screening blood test? This is also called the quad screen or AFP alpha fetoprotein test. It screens for chromosomal abnormalities and neural tube defects. It's optional but recommended. Results usually come back within a week or 2. If results are concerning, you'll be offered more definitive testing like amniocentesis. Starting to plan for the anatomy scan. The big ultrasound happens around week 18 to 20. Your doctor will schedule it during this time. This is the period when you'll likely feel your baby move for the first time. This moment, called quickening, is one of the most magical parts of pregnancy. When will you feel movement? If this is your first baby, you'll probably feel movement between 18 and 20 weeks. If you've been pregnant before, you might feel it earlier, around 15 to 17 weeks, because you know what you're looking for. What does it feel like? Early movements feel like flutters, bubbles, or butterflies in your belly. Some women describe it as gas or popcorn popping. It's very subtle at first. You might not even be sure if it's the baby or just digestion. As the weeks go on, the movements get stronger and more obvious. What if you don't feel movement by 20 weeks? Don't panic. If you have an anterior placenta on the front wall of your uterus, it cushions the movements and makes them harder to feel. Mention it to your doctor at your next appointment. They can check the baby's heartbeat and do an ultrasound if needed. Physical changes during weeks 16-20. Round ligament pain. This is a sharp stabbing pain in your lower abdomen or groin, usually on one side. It happens when the ligaments supporting your uterus stretch as your belly grows. It's sudden and can make you gasp, but it's harmless. I got this constantly with all 3 pregnancies, especially when I stood up quickly or rolled over in bed. Your belly button might pop out. If you have an innie belly button, it might become an outie as your uterus expands. This is temporary. ITL go back to normal after delivery. Skin changes. The pregnancy glow people talk about is real for some women. Increased blood flow and hormones can make your skin look radiant. but you might also develop melasma, dark patches on your face, linea nigra, a dark line down your belly, or darkening of your nipples and areolas. All normal and mostly reversible after pregnancy. Nasal congestion. Pregnancy rhinitis is a thing. Your nasal passages can swell due to increased blood volume and hormones, making you feel constantly stuffy. Saline spray can help. Just don't use decongestant sprays without checking with your doctor first. The anatomy scan is one of the biggest appointments of your entire pregnancy. This is the detailed ultrasound where they check the baby's development from head to toe. What happens during the anatomy scan? The ultrasound tech will measure the baby's head, brain, face, spine, heart, stomach, kidneys, bladder, arms, legs, hands, and feet. They check the placenta location. They measure the amniotic fluid. They look at the umbilical cord. The scan usually takes 30 to 60 minutes. It's amazing to see your baby in such detail. Can you find out the baby's sex? Yes, if you want to. Most babies cooperate and show their parts clearly by 20 weeks. Some parents want to know. Some want to be surprised. Both are fine. I found out with all three of mine because I'm terrible with surprises. What if they find something concerning? The anatomy scan detects many, though not all, structural abnormalities. If something looks off, you'll be referred to a maternal fetal medicine specialist for a more detailed scan and consultation. Most of the time, everything looks perfect, but knowing this scan is happening can be stressful. Try to remember, this scan is designed to catch problems early so they can be managed. Finding something is better than not knowing. What if the placenta is low? If the placenta is covering or close to the cervix, placenta previa, they'll note it but won't panic yet. The placenta often moves up as the uterus grows. They'll recheck it later in pregnancy, around week 20. Your pregnancy becomes very real and very visible. You can't hide the bump anymore. Strangers will start commenting. People will want to touch your belly. Please don't let them if it bothers you. Physical challenges during weeks 2024. Back pain. Your growing belly shifts your center of gravity forward, putting strain on your lower back. Your ligaments are also looser due to the hormone relaxin, which makes your joints less stable. What helps? Good posture, supportive shoes, pregnancy support belts, prenatal yoga, and gentle stretching. I lived in a support belt during my third pregnancy. Hip and pelvic pain. As your pelvis widens to prepare for birth, you might feel aching or sharp pains in your hips, especially at night. A pregnancy pillow between your knees can help. So can prenatal chiropractic care or physical therapy. Heartburn and indigestion. The hormone progesterone relaxes the valve between your stomach and esophagus, allowing acid to creep up. Plus, your growing uterus is pushing your stomach upward. Eat smaller, more frequent meals. Avoid spicy or acidic foods. Sleep propped up on pillows. Tums or Pepcid are generally safe, but check with your doctor. Leg cramps. Many women get painful leg cramps, especially at night. Stretching before bed, staying hydrated, and getting enough magnesium and potassium can help. If you get a cramp, flex your foot upward, toes toward your shin to relieve it. Braxton Hicks contractions. You might start feeling your uterus tighten and release. These are practice contractions. They're irregular, usually painless, and they go away when you change positions or drink water. Real labor contractions get stronger, longer, and closer together over time. Braxton Hicks don't. Varicose veins. Increased blood volume and pressure from the uterus can cause veins in your legs, or even your vulva to bulge. Compression stockings can help. Elevate your legs when you can. They usually improve after delivery. Swelling, edema. Mild swelling in your feet and ankles is normal, especially at the end of the day. Elevate your feet. Drink water, counterintuitive, but it helps. Avoid standing for long periods. Sudden severe swelling, especially in your hands and face, is not normal. Call your doctor immediately. It could be preeclampsia. Around week 24 to 28, you'll have another important test, the glucose screening for gestational diabetes. What is the glucose test? You drink a very sweet glucose drink. Tastes like flat orange soda. Then they test your blood sugar 1 hour later. If your blood sugar is high, you'll need a 3-hour glucose tolerance test to confirm whether you have gestational diabetes. Why does this matter? Gestational diabetes, GD, affects about 6 to 9% of pregnancies. It means your body isn't processing sugar effectively during pregnancy. This can lead to a larger baby, delivery complications, and other issues if not managed. The good news? It's very manageable with diet, exercise, and sometimes medication, and it usually goes away after delivery. I had gestational diabetes with my third baby. I had to check my blood sugar 4 times a day and adjust my diet. It was annoying but doable. Physical changes during weeks 24-27. Your belly is getting big. By week 27, you're in the final stretch of the second trimester. Your uterus is about the size of a basketball. You might feel off balance. Bending over to tie your shoes is getting harder. Baby movements are stronger. You're not just feeling flutters anymore. You're feeling definite kicks, punches, and rolls. Sometimes you can see your belly move from the outside. It's wild. Your partner can probably feel the baby kick now if they put their hand on your belly. Shortness of breath. Your uterus is pushing up on your diaphragm, giving your lungs less room to expand. You might feel winded just walking upstairs or talking for a long time. This is normal. It gets worse in the third trimester, but improves once the baby drops lower in late pregnancy. Restless leg syndrome. Some women develop this annoying condition where your legs feel like they need to move, especially at night. It's linked to iron deficiency in some cases. Ask your doctor to check your iron levels. Preparing for the third trimester. This is a good time to start thinking about birth classes. Sign up now if you haven't already. Pediatrician interviews. You'll need a doctor for the baby. Baby registry. Start creating it so people know what you need. Nursery planning. You don't need everything ready yet, but start thinking about it. Let's talk about what's happening emotionally during the second trimester. Feeling more connected to the baby. Once you feel movement, the baby becomes real in a new way. It's not just an abstract concept anymore. There's a person in there. This can be exciting and terrifying at the same time. Gender reveal and name stress. If you found out the sex, you might be planning a gender reveal party or just sharing the news. You're probably also thinking about names. This can be a fun conversation with your partner or a source of major stress if you disagree. Anxiety about the anatomy scan or glucose test. Waiting for test results is nerve-wracking. It's normal to worry. Try to remember. Most results come back normal. But if there's a problem, knowing about it is better than not knowing. Relationship changes. Your partner might be more involved now that they can feel the baby move and see your belly grow. Or they might feel disconnected if you're focused on the pregnancy and they don't know how to help. Keep communicating. Let them be part of the process. Body image struggles. Your body is changing rapidly. Some women love their pregnant bodies. Others feel uncomfortable or even disconnected from how they look. Both reactions are valid. Try to be kind to yourself. Your body is doing something incredible. Excitement mixed with fear. You're past the highest risk period for miscarriage. You can see the baby on ultrasound. You can feel them move, but you're also getting closer to labor and the reality of being responsible for a tiny human. It's normal to feel excited and terrified at the same time. So let's recap the second trimester. Weeks 13. 16 energy returns, nausea fades, belly. Start showing quad screen blood test weeks. 16-20. You feel the baby move, quickening round ligament pain. Skin changes, anatomy scan, weeks 20-24. Visible growing belly, back pain, hip pain, heartburn, Braxton Hicks. Contractions, leg cramps, swelling, weeks 24-27. Glucose screening test, stronger baby movements. Shortness of breath, preparing for third trimester. The second trimester is often called the honeymoon phase because it's generally the most comfortable, but that doesn't mean it's easy or that you won't have challenges. You might feel great some days and terrible others. That's normal. You might love being pregnant or you might hate it. Both are okay. What I wish someone had told me, the second trimester is when pregnancy starts to feel real and exciting. But it's also when you start realizing how much your life is about to change. That's a lot to process. Be gentle with yourself. Rest when you need to. Ask for help. Enjoy the good days and survive the hard ones. You're doing great. If this video helped you know what to expect, hit that subscribe button. My next video is all about pregnancy after 35 and what actually changes with advanced maternal age. Drop a comment and tell me, what's been your biggest second trimester surprise or challenge? Let's support each other. You're almost 2/3 of the way there. Keep going. You've got this. I'll see you in the next one.